is Scott Weich and I'm Professor of Mental Health at the University of Sheffield. I'm a consultant psychiatrist at Sheffield Health and Social Care Foundation Trust, and I'm Director of the Complex Emotions Hub. So what do we mean by complex emotions? Complex emotions are difficult, often very intense, confusing feelings, experiences and emotions that can be hard to cope with. These can include difficulties in relationships and fears of being abandoned or rejected. Complex emotions also reflect difficulties in regulating or controlling emotions when they're very intense, and sometimes trying to cope with or manage the impulses that arise from these feelings and can lead to difficulties such as self-harm or even suicidal thoughts and actions. Our aim as a hub is to try to transform and improve the care that people who experience complex emotions receive, and also to support professionals who are doing their best to try to provide support and care. Complex emotional problems are under-researched within mental health research and medical research generally, and we're delighted to have the opportunity to undertake this research. These problems are not just difficult and distressing for the people who experience them, but they're also life-threatening. We'll work with people with lived experience, and that will be at the heart of everything we do. A number of people in our research team have lived experience, not just of complex emotional difficulties, but also of receiving a diagnosis and of seeking care. We will recruit around 200 people who have lived experience of complex emotional difficulties. We're going to recruit very widely and way beyond mental health services. We hope to generate genuinely new discoveries and findings, and to work with partners across health and social care settings, in the voluntary sector, and even industry partners in the tech sector to find real, meaningful and beneficial ways of helping. Thank you for listening.